Welcome to Hacking Health, the podcast for future-focused health experts, thought leaders and change makers who are passionate about making health accessible for everyone. I'm your host, Sarah Bartholomeusz, and in this podcast, we'll be diving deep into the world of health tech, exploring the latest innovations, sharing success stories, and discussing the challenges and opportunities that lie ahead, specifically in Australia. Our mission is to empower our listeners with knowledge and insights that will help them drive change and make positive impact on the health system, because together we can get to the future faster. I've loved my latest interviews with Danielle, Owen, Whitford and Anoushka Gungadin, and I'm excited to get back into another deep dive looking at the themes and issues raised. While they each have unique experiences and perspectives, there were some common themes that emerged from these two conversations. One of the most striking themes shared by Danielle and Anoushka is their belief in the transformative potential of technology to redefine healthcare. Both leaders are pioneering in their respective fields, harnessing technology not just a tool, but as a catalyst for systemic change. Their approaches, while applied in different domains, highlight a shared vision: technology as a means of improving human outcomes by addressing critical gaps in traditional models. For Danielle, the power of technology lies in its ability to personalise at scale in the workplace. Through her AI platform, Pioneer, Danielle explained that her technology allows organisations to scale personalised care in ways that were previously unimaginable, expressing that the technology allows them to understand what's going on in real time in a private and safe way, but actually tailor what's helpful for them. Similarly, Anoushka sees technology as a means of reshaping healthcare delivery, particularly for expectant mothers. By shifting from a hospital-centric model to a patient-centric approach, her HERA app enables mothers to access continuous care through tailored plans, real-time monitoring, and educational resources. Anoushka described the significance of this shift, identifying that the app redefines the relationship between the care provider and the mums, bringing convenience at the same level of medical care and safety. This integration of technology ensures that mothers are equipped with tools to manage their health independently while maintaining the safety net of professional oversight. Both stories reveal an important nuance. The transformative power of technology depends not on the technology itself, but how it is applied. Together, both Danielle and Anoushka's work underscores a broader lesson for health tech innovators that true transformation occurs when technology is used with empathy, purpose, and a focus on people. Another common theme was accessibility and equity in healthcare. Danielle and Anoushka emphasised that equitable access to healthcare solutions is not just a technological challenge, but a moral responsibility. Danielle's commitment to equity is rooted in the design and application of her AI platform. From the start, she prioritised privacy and inclusivity, recognising that trust is a crucial element of accessibility. Her research revealed that employees often hesitate to share their stress levels due to fear of professional repercussions, explaining that from day one, we made a decision that all individual data is private and confidential to that individual, which turned out to be an incredibly clever decision because it's one of the differentiators now that guarantees privacy and confidentiality. By ensuring that managers see only anonymised aggregated data, Pioneer makes mental health support accessible to all employees, regardless of organisational size or hierarchy. For Anoushka, the challenge of equity is particularly acute in maternal health care, where disparities in access are stark. Through the HERA app, she aims to democratise care for expectant mothers, especially those in remote or less fortunate areas. She shared a powerful example from her work in Florida, where the app was deployed in a hospital serving a diverse population. Sharing that, one of the mums was onboarding to HealthTech. She didn't speak much English, but spoke French and Creole. HealthTech were able to provide care to the patient in her native language. For her, this was the difference between having care or not having care. This moment illustrates how technology can overcome barriers that are cultural, geographic, or linguistic. The HealthTech app is designed to adapt to different contexts, offering multilingual support and tailoring care plans to individual needs, highlighting the significant impact of accessibility to healthcare, particularly in rural and remote areas. The contrast between their work highlights the breadth of accessibility challenges in healthcare. Both speakers emphasised that accessibility is more than just about removing barriers. It's about empowering individuals. Danielle and Anoushka remind us that the solutions we create must not only reach those who need them, but also resonate with their unique needs and experiences. Equity is not a one-size-fits-all concept. It is rather a commitment to designing healthcare systems that reflect the diversity of the populations they serve. The next theme discussed by both guests was ethical considerations. Both Danielle and Anoushka highlighted the importance of embedding ethical principles into the design and implementation of their innovative solutions. For Danielle, ethics in AI has been a priority from the very inception of Pioneer. She recognised early on that ethical missteps could undermine the trust necessary for her platform to function effectively. Danielle explained that as not all AI is created equal, they decided to adopt the CSIRO's ethical AI guidelines to ensure transparency, fairness, and privacy in everything they do. Moreover, Anoushka's perspective added another dimension to the ethical conversation, emphasising how failing to update healthcare systems to accommodate new technologies can perpetuate inequalities. Anoushka highlighted the importance of culturally sensitive care, noting how ethical care isn't just about following guidelines, but about understanding how cultural relevance in the delivery of care is critical for its success. Both women demonstrated that ethics in health technology is not static, but rather a dynamic process that requires ongoing reflection, collaboration, and adaptation. Lastly, a forward-thinking focus on prevention and empowerment emerged as a cornerstone of both conversations. It was evident that both leaders are deeply committed to shifting the healthcare paradigm from reactive to proactive care, recognising that addressing issues early on not only reduces burdens on the systems, but also empowers individuals to take control of their well-being. For Danielle, prevention is at the core of Pioneer's AI platform by seeking to identify and address workplace stress before it escalates into burnout. Her platform sees real-time data to monitor stress levels and provide timely interventions, enabling employees to make small adjustments before their well-being is compromised. This preventative approach transforms workplace culture by normalising the idea that seeking support is not a sign of failure, but a proactive step towards resilience. Furthermore, Anoushka's work with HealthTech echoes this ethos, focusing on preventative maternal health care by integrating education and empowerment into the app. HealthTech equips mothers to make informed decisions about their health. Anoushka's emphasis on prevention extends beyond the individual, alleviating pressure on the healthcare system and ensuring resources are available for critical cases. This dual focus on individual and systemic impact reflects her belief that prevention is a shared responsibility. Both leaders highlight the idea that empowering individuals with the right tools and information enables them to take ownership of their health, ultimately contributing to better outcomes. Together, their work challenges traditional models that focus on addressing problems after they arise. They show how prevention can be both personalised and scalable, improving individual well-being while reducing systemic strain. By combining technology with a deep understanding of human needs, Danielle and Anoushka redefine what it means to care for people. By embracing themes of the transformative power of technology, accessibility and equity, ethics, prevention, empowerment, and human-centric innovation, leaders like Danielle and Anoushka inspire us to reimagine healthcare as proactive, personalised, and inclusive. That wraps up this episode of this season of Hacking Health. Stay tuned for what's coming in the new year by connecting with Hacking Health and You Legal on our social media channels, linked in the description below. In the meantime, catch up on our past episodes here on YouTube or Spotify and join the conversation in our private Facebook group, You Legal for Doctors, as together we can get to the future faster.